Hi guys, my name's Eloise Benedos and I'm here with my client Sonia for part one of the assessment 4. So I'll be conducting a postural assessment on Sonia using the postural observation form. So just to begin, I've got Sonia just standing against a white wall here, and I'm just going to get her to just shake out her body just to give her a natural stand, and then I'm just going to get you to stand there. And just for here, I'm just going to imagine that there's a straight plumb line that's going directly through the centre of Sonia's midline. So to start, I'm just going to look at the anterior view of Sonia. And I'm just going to start with the foot and the ankle complex, so down the bottom here. Sorry about the angle, I've just had to do a selfie for this. So just looking at Sonia's feet and her ankles, I can see that her left foot is slightly pronating. So that means that it's just slightly rolling inwards and her big toe is just pointing a bit outwards. And also there's just a slight arch in her foot. Other than that, there's no major observations to see there. Now just looking at her hips as well, I can see that there is a slight asymmetry there. So that's anterior superior, the iliac spine, sorry. Oops. Right, so just looking at her symmetry, I can see that her left hip, just where the bone is here, it's slightly sitting just a little bit higher than the right side. And that's also just giving her a bit of an anterior pelvic tilt as well. So now just looking at her thoracic spine, so just moving up towards the body. I can see that her left shoulder is just slightly deviated, so her right shoulder is just a little bit depressed. So it's just sitting a little bit higher as well. This also impacts on her hand symmetry as well. Just looking at how her hands are positioned next to her body, I can see a lot more of her hand than just her thumb. So they're slightly just rolling inwards as well. It's also, so her thumb is just pointing a bit inwards. So now I'll just have Sonia turn around and I'll just have a look at her posterior view. From here, just focusing back down onto the foot and the ankle complex, I can see that she has, her left ankle is slightly averted. So her left ankle is just slightly everted as opposed to her right. So again, this kind of goes along with the pronation that's occurring in her feet as well. Now just looking a bit up, I can see that Sonia has just slight knocking of the knees. So her knees are just sort of coming in a little bit. Right, so I can see just a slight knocking of Sonia's knees, so they're just slightly coming inwards a little bit. Now just moving up a little bit further, so around her iliac crest, there doesn't seem to be much asymmetric observations that are occurring there. And also just her upper body, there's no real winging back or kyphosis occurring, and her scapulars are quite asymmetrical as well, so they're not really deviated or anything happening up there. Apart from her shoulders, I can still see that there is a slight deviation occurring there. So now I'm just going to get Sonia to just turn onto her lateral view, so just onto the side, and I'm just going to imagine that there's a plumb line going through the center of her body again, and it's just slightly sitting in front of her ankle or the calcaneus bone. From here, I can see that Sonia, just looking down at her foot and ankle complex again, that there's slight dorsiflexion occurring sorry, occurring in her left foot. So this is causing Sonia's body to be slightly leaning forward, and you can see that her knees are quite straight and stretched. So there's a little bit of hyperextension occurring in her knees. And her hips are always also leaning a little bit forward. So this is, again, as I mentioned before, causing a bit of an anterior pelvic tilt. So her whole body is sort of just leaning a little bit forward as she's standing there. Due to this anterior pelvic tilt as well, I can see that just in her back here there's a slight lordosis occurring, so just a little bit of a more arched lower curve that's happening in her back there. And also just moving up as well, I can see because of this forward motion that Sonia's having with her body, her shoulders are just slightly rolling a little bit forward as well. And this is, occurring with the forward tilt. So now just for the movement preparation phase, I'm going to have Sonia perform a sagittal step, which will allow me to look further at her ankle complex and see what her body and how her body is moving. Alright, so as she just repeats this, I'm just going to get her to do about 5 steps on each foot just as I explain it. She's repeating this, and just from an anterior perspective, I can see that Sonia has a slight medial deviation of her right knee, also known as varus, occurring. So I can see that as her knee is coming in towards the midline of her body as she steps forward. As she's changing legs as well, I can also just see that with her, that's occurring with both legs as she's stepping forward. So now I'm just going to get you to turn onto the side. Yep, and just keep repeating that same step. Yep. So now just from a lateral perspective, I can see that her heel is lifting up on her stance foot, and also on her placing foot it's slightly lifting up as well as she steps forward. And this is occurring with both legs again. So this shows that it does not want to take responsibility for the load as she's stepping forward, which puts extra pressure on her toes to take all that load. So now I'm just going to get Sonia to perform a lateral step or lunge. So as she's doing this, I'm just observing her hip complex. So while Sonia's repeating this step, I can see that for both legs, her knees are actually stacking over her foot. So her knees coming past her foot. So this just kind of shows that, or it can presume that her body is trying to compensate for the extra load that's being placed through this movement. So now, just to finish off, I'll get Sonia. So lastly, I'm just going to get Sonia to perform a transverse step and reach, and I'm just going to be looking from the posterior view and mainly focusing on her thoracic spine. So while she performs this, I can see that Sonia has slight poor lateral flexion that's occurring in her spine, and there isn't much movement through her scapulars as well when she performs a lateral step. So this can be due to her shoulder capsules being in the rolled forward state that I observed during the postural assessment. Also, I can notice that there may be a bit of difficult, when performing the step, both her stance legs on either side are not straight, so they're bent, which shows that there might be a bit of difficulty allowing a stabilizing relationship between the hip and the ankle complexes. So that ends my static and static posture movement observations for Sonia. Next we'll be looking at self-myofascial releases that Sonia can perform. Oh, you can stop now, sorry. That she can perform to help release tension and pressure from various trigger points in her body.